Welcome back to the third and final installment of Mission's Medical Memories. We have seen how institutions and events surrounding Mission's health history have impacted our community, but now we turn to how those pieces fit within the wider theme of change. Change occurs and is observed in many ways, especially in such a dynamic field like medicine. The Mission Museum strives to preserve the tools, materials, and other objects from both the past and present in order to better understand how and why these changes happen.
Most of the time, industries evolve because of people or technology. One of the pieces in the museum's collection that survived the transition between Mission's old and new hospital buildings is the nurse's cap donated by former head nurse at Mission Memorial Hospital, Darlene Manzer. After a post-war boom in Mission's population, a new Mission Memorial Hospital opened on October 24, 1965, at its present location on Heard Street. Darlene Manzer experienced nursing in both the old and new Mission Memorial Hospital. While the graduate nurse's cap, indicated by the black band, was issued by the Royal Columbian Hospital, it also marks the beginning of Darlene Manzer's nursing career, the majority of which was spent at Mission Memorial Hospital. Her cap is actually an evolution of the veils that nurses used to wear in order to contain a nurse's hair and protect themselves from pathogens. Although caps like this tended to be too small to hold hair, they were a way of identifying graduates from a particular nursing school and levels of seniority. These decorative caps started in the decade following World War I and marked a turn in how nurses would be presented. Nurses still wore bibs, aprons, and long-sleeve cuffs, but much of the uniform was becoming more decorative and less functional. During World War II, they changed yet again to accommodate for shortages in fabric and increased wear and tear, abandoning the long sleeves and replacing most dresses with skirts or pants. The way nurses and other hospital staff dress may have changed, but the work they do is still just as integral to both the Mission Memorial Hospital and to the Mission community as a whole. As much as the way health professionals dress has changed, the way they perform their jobs has changed even more. Technology, materials, practices, and other aspects of healthcare have changed many times over the years. This medical catalog from the 1960s allows us to see which technologies and equipment were popular or new at the time, but also how they were advertised. The F. Hart's Company produced the Hospital and Physicians Equipment and Supplies catalog to sell various supplies including operating tables, resuscitation equipment, physiotherapy needs, surgical appliances, office furnishings, lab equipment, and anatomical models. The museum has many of these tools, and more, in its collection. Of the medical objects in this museum, this incubator is one of the few that has its history literally written on top of it. Inside, there is a white cushion for a baby to sleep on and a measurement piece with a light bulb attached. A note on the side says, "Keep babies covered in this incubator. Heat irregular," indicating that it was at times unsafe to use. The Mission Memorial Hospital has faced many barriers with funding certain areas of the hospital, and now no longer has a maternity ward. Before modern anesthesiology, surgery was often very dangerous and incredibly painful. Ether masks, like this one, were typically used in the mid-19th and early 20th centuries in order to reduce the pain felt by the patient. However, many of these chemicals used as ether led to irregular heartbeats and even death. The wire mesh was stuffed with gauze, and the ether would be dripped slowly onto the mask. The ether would then evaporate and be inhaled by the patient. Chloroform was a very common kind of ether at the time, and even Queen Victoria was reported to have used it as she gave birth to Prince Leopold in 1853 and Princess Beatrice in 1857. This instrument was used by Dr. E. Erickson, a general practitioner and orthopedic surgeon who came to Mission in 1932. He was known in the field as one of the best bone doctors and was an early practitioner at the Mission Memorial Hospital. Luckily, by the 1930s, medical professionals had a more complete understanding of both anesthetics and germ theory, which helped orthopedic surgeons like Dr. Erickson to work safely and dramatically increase the quality of care given to their patients. Many of the museum's other medical artifacts reflect times and situations different from what many of us are used to. This fetoscope, an instrument similar to a stethoscope, but built very small to listen to the heartbeat of an infant, are very similar to their modern counterparts. Often, it is the materials or small inner workings that change, as medical professionals learn more or require different strategies given their environment. For example, as previously mentioned when discussing nurse uniforms, World War II put a strain on many of the traditional materials used in the production of medical equipment. One of the ways medics and health professionals in World War II had to adapt was by changing much of their medical storage to burlap, or similar durable materials. This Red Cross bag was used solely in World War II, but much of the equipment and materials from the war were kept and used by hospitals and medics. Other medical equipment has also changed over the years. Take this metal tongue depressor, for example. Tongue depressors now are typically made out of wood and use a much simpler design. Because they are inexpensive and difficult to clean, they are often disposed of immediately after use. The metal tongue depressor, however, is more expensive and fairly easy to clean, so they would see repeated use over long periods of time. Still, using disposable tongue depressors reduces the time spent cleaning and maintaining equipment. Similarly, models like the mercury manometer in the museum's collection, designed to measure a patient's blood pressure, are slowly being replaced by digital blood pressure monitors. Mercury, while fairly stable and a good indicator of pressure in its liquid state, represents a health risk if damage to the manometer results in a leak. We are currently experiencing a time of significant change in Mission's health history with the COVID-19 pandemic. The Mission Archives and the Mission Museum have been collecting objects and documents associated with the pandemic through the Life at 2 Meters initiative. This pandemic-focused initiative is intended to capture these unprecedented times, recognizing that history happens each day. It is important to remember how the government, businesses, charitable groups, other institutions, communities, and individuals have been living through such an important period of time. If you have items or documents that have significance to the pandemic and mission, please consider donating them so we can record these memories for future generations to learn from and enjoy.
This concludes our Medical Memories video series. If you have pandemic objects connected to mission, please visit our Life at 2 Meters page on our website. Thank you for watching.